You want to eat this every single day if you want to clean out the arteries and prevent plaque from building up. And even if you have plaque, what I'm going to share with you will actually help not just minimize the plaque, but reverse the plaque. I just need to clear up the biggest confusion that people have with heart attacks, that a heart attack is caused by the artery filling up with plaque. That is absolutely not what happens. What typically happens is you have a small amount of plaque, but it's a certain type of plaque, because there's two types of plaque. There's hard plaque, which has been calcified, it's more stable, and then you have soft plaque, which is very unstable. And so you literally can have even 20% of the plaque that builds up right here, and then it ruptures, and then what happens, your immune system comes in and creates a clotting reaction, and the clot creates the heart attack. And of course, cholesterol usually gets the blame, but you're going to find out it's not the cholesterol at all. And it's so important to understand the basics of this, because what most people end up doing is going to the doctor and their cholesterol is high, they're put on a statin, and they get a lot of side effects, but the statin never gets rid of the root cause. So let's first talk about this entire chain of events that occurs. Over here, you have something called downstream. This is when you get the plaque building up. This is when you get the symptoms, and this is where you eventually have the heart attack and you might die. Well, this problem has been brewing in the oven for 10 to 20 to 30 or more years, okay? What happens before that is something called upstream events. And the reason why this is so important is because it's missing in medicine. Medicine does not study root causes. They don't get into them. They're so focused down here, managing the symptoms. So the best way to really understand this is in the arteries, you have this very thin layer inside the artery called the endothelium. And that endothelium is so vitally important to keep the blood flowing and protect anything from getting inside the wall of the artery. And there's something in there called nitric oxide, which actually helps the contraction and relaxation of this artery. But of course, that coating can be destroyed over time. Just picture someone coming in there with sandpaper and roughing it up. And that sandpaper is either smoking or chronic high insulin, because that person has chronically high blood glucose. But it can also come from the ingredients in ultra-processed foods. All of that irritates this inner, very thin, fragile area of the inside of the artery called the endothelium. So over time, we go into the next phase. And this is where we have inflammation and damage in that little endothelial wall. It's like this little wound that happens in the inside of the arteries. So we have inflammation, which then tells the immune system, the white blood cells, to come in and start repairing it. Now, this is where I want to bring in this cholesterol thing, right? Because when you go to the doctor, you get your total cholesterol tested, you get your HDL and your LDL. And a lot of times people talk about LDL as being bad and HDL being good. The HDL is taking cholesterol from the tissues and bringing it back to the liver, okay? But the LDL is depositing cholesterol in certain parts of the body. You need to know there's two types of LDL, okay? There's the large one, it's called large buoyant. You have the small one right here. This is called small dense. So when you get a typical blood test and they measure your total LDL, it really does not tell you what's going on between this and this. And that is why it's so important to ask your doctor for an advanced lipid profile to be able to assess the particle size. Why? Because the big ones don't invade the arteries, okay? They just float through. They don't cause damage. The real damage with LDL is the small dense particle size. It gets stuck in the arteries because it's small. So if you're getting these stuck in that wall, you're going to get inflammation. And so what comes to rescue this is the white blood cell. The specific type of white blood cell, not that you need to know this, is called the macrophage. It's going to go in there and it's going to start eating up these guys right here. And it doesn't know when to stop. So it'll just keep eating and eating and eating. And when they look through a microscope at what's happening, it looks like it's all foamy, okay? And that's why they came up with the word foam cells, which are basically bloated white blood cells because they've eaten too much of this oxidative LDL cholesterol. And then they die. Over time, when we're talking about soft plaque, underneath that very tiny cap, you don't just have cholesterol. you have a graveyard of dead white blood cells. And yes, you do have some cholesterol, but you also have calcium that comes in there that helps act as a Band-Aid. So when you get your cholesterol tested and the doctor says we need to lower your cholesterol with a statin, that doesn't address the immune reaction, the foam cells, the graveyard. So this idea that cholesterol is causing your heart attacks is completely false. There was a massive study by UCLA involving over 135,000 people who had heart attacks. 75% of them had normal LDL. So how can you say the cause was cholesterol? The problem with the whole medical system is they're not looking earlier. They're not looking upstream. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high-quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information. The big question is what allowed that cholesterol to get there in the first place? We had the small, dense lipoproteins. What causes those? That would be a good question to ask, right? Well, if we go earlier, it's excessive triglycerides from carbohydrates, because excess carbohydrates turn into the storage form, which is triglycerides. When the liver is overloaded because the person had too many carbohydrates, then you start developing excessive amounts of small, dense particle size LDL. That is at the root cause. These little guys get oxidized because they hang around a lot more, creating an immune reaction. This is the missing piece of the puzzle right here. If you're going to take a statin, you have to consider the recent study put out on statins that said that, oh, they're much safer than we thought. There's only a 5% risk of getting muscle problems, right? Well, let's just bring that up for a second, because there's several really huge holes in that study. Number one, the CTT, which is an organization involved in that study, will not release the raw data of that study, despite years of trying to get that data. And this is the problem with research, is that you can't see the raw data until it creates a problem, and years later, you end up in a lawsuit, like with many medications that were supposed to be safe, and then all of a sudden they find out they're actually very deadly. Well, the CTT also happened to take a lot of money from Big Pharma. I'm talking $200 million were donated to the CTT organization. So we have conflict of interest right there. Observational studies show that there's a much greater risk of getting muscle damage and other side effects. But the biggest thing that jumped out in the study was something called the run-in period. Okay, well, what does that mean? It's a trick, okay? Before they even randomize these people, what they'll do is they'll have everyone on the drug, and they find out who reacts to it, and then they will take those people that couldn't tolerate the drug and remove them from the study. So now we have a layer that is kind of hidden from the average person. They don't realize they're screening out the people that are going to react up front and removing them from the study. Well, guess what that's going to do? That's going to alter the study big time. When you take a statin, you're blocking the production of cholesterol. You are reducing LDL, but you're also blocking coenzyme Q10, which is a very important nutrient for your mitochondria. But what is this remedy that we need to talk about that you can help to reverse this soft plaque? Here it is right here, aged garlic extract. Now this is really interesting because there's 2 randomized controlled trials with aged garlic using 2,400 milligrams per day. I mean, this is huge because they use angiogram studies, and they found that it not just stabilized the situation, it reduced the soft plaque. Just to differentiate between soft plaque and hard plaque, sometimes you can't actually get rid of it because it's calcified and it's stable. And it really is not going to cause a problem for most people. It rarely creates a problem. It's the soft plaque that most people need to be concerned about. And guess what? Aged garlic helps reduce the soft plaque in a significant way. It also can help lower blood pressure moderately. It also acts as an antioxidant. It also can help thin the blood. So this is why you have to work with the doctor if you're on a blood thinning medication. Now, what about regular garlic? When you crush it and you take it, well, that's really effective for blood pressure, thinning of the blood, clotting, but it does not have the powerful effects of reducing soft plaque. It might, it's just never been studied before. Now, of course, I'm also going to recommend exercise. It can also increase nitric oxide, especially if you're outside in the sun. Super important for the inside of the arteries and blood flow. Then we have magnesium, completely essential. Magnesium is the cofactor to help the mitochondria, the heart, the arteries, and also magnesium controls excess calcification. Super important. Fish oils also been known to help reduce soft plaque, not to the level aged garlic can do it, but it can actually help. I would recommend cod liver oil because it has vitamin A and vitamin D as well. And of course, intermittent fasting will reduce inflammation and also reduce that insulin resistance, which is at the heart of this whole problem. And of course, go on a low carb diet because again, we want to get the sugar out so we don't form too many triglycerides that then turn into the small dense LDL. If you're doing all these things right here, you're going to lower the small dense dangerous LDL that we've talked about. So a lot of people ask me, what supplements do I recommend? Now, of course, I'm not biased of my own high quality supplement line, but if you go to Amazon and type Dr. Berg supplements, you'll find more information.